Welcome. It is 11 o'clock on Wednesday, and we are here just kind of talking. We were saying confronting the crisis, Dr. Ahmed, but now, things are changing so much that I don't know if we want to confront it or how it's going to be, because it seems like it's going to be with us for a long time. Today, I have a real treat because Dr. Salman Ahmed is not only a pediatrician at Children's Medical Center, but he is also an infectious disease doctor. And in talking before we came live, I learned some things. Today we're going to talk about a little bit about Kawasaki disease, and then we're going to move into MIS, I believe it is, correct?
Yes.
And that is what we need to be paying attention to for our youth. So first of all, Dr. Ahmed, when the news came out, Kawasaki disease, it kind of appeared on the right hand of the paper, and it was like cases of Kawasaki disease. Now we've moved away from that. Why is that?
So just for our viewers to have a better perspective, some of them, they already are familiar with Kawasaki disease, but the ones who don't, it's an acute febrile illness where these children, they run fever for more than 5 days. Not just fevers, but they are very, very sick. Some of them, they have red eyes, they have chapped lips, they have rash all over. And if you do blood tests on these children, the blood tests are like they have elevated white cell count, they have elevated inflammatory markers. We have traditionally treated Kawasaki disease with immunoglobulin and high-dose aspirin therapy. Recently, we had a cluster of cases that were initially described in Italy and then UK, and these children had a similar presentation like Kawasaki disease, but they occurred in association with COVID-19. What we have learned is since then there have been several cases reported in New York, New Jersey, Massachusetts. There have been cases reported from Washington as well. These children are a little different than, in a way they are similar to Kawasaki disease, but they seem to be much more sick. And they have a higher incidence of involvement of heart disease. Kawasaki disease, the reason you worry about Kawasaki disease is because it's the most common cause of acquired heart disease in children. As much as 1/4 of the children with Kawasaki disease, they get involvement of the coronary blood vessels or heart tissues. And if they are properly treated, you lower that risk to about 5%. With this new entity, which is multi-system inflammatory syndrome, as much as 60% of the children are presenting with involvement of heart. They are also occurring in a higher age group, up to 7, 8, 10 years of age, and it's taking them longer to recover. There have been some incidents of mortality as well, but the teaching hospitals, they're doing a great job in taking care of these children. So
well, what I didn't understand about this is I thought that the virus that causes COVID-19 was mutating to cause this MSI. However, you explained to me earlier, and if you'll share with the group.
Yes. So I think a better explanation is when these children get this MIS or multi-system inflammatory disease, they've had COVID-19 infection in the 4 to 6 weeks prior to developing these symptoms. So at the time of their presentation, they are not acutely infected with COVID-19. Some of them, they have laboratory evidence of COVID-19 infection. Some of them, they have a strong family history of exposure. So that's how we are relating COVID-19. And all of a sudden, when you have a new medical condition or a syndrome, and there is no other good explanation of it, and we know that the clusters of these patients have been reported in areas where there has been a very high incidence of COVID-19. So that's how we've made this connection.
And so when a new thing or new disease or new ailment comes on the scene, has MSI been around before, or is it new because of this COVID-19?
So MIS is a new description, but it's a very non-specific description. If someone who is very sick, who has involvement of multi-organs, kidneys, liver, heart, lungs, or they present in a toxic state, that is basically an MIS. but this is the first time we have related such a presentation to COVID-19.
And so, really, what's happened is, in much the same way, I think that was it the cytokine storm for adults, which was your own body fighting the virus so hard that it made you even more sick.
Yes, so it's more like an immune-mediated response where infection happened several weeks or few weeks prior to them developing symptoms, and it's just like an exaggerated immune response that's causing all the inflammation in their body, inflammation of their blood vessels, and causing blood clots, causing high fevers, and just setting them into organ failure.
And that is, if I'm not mistaken, because as I look at the cases here, and I know there's been a lot of testing, some of it's been reliable, some of it unfortunately has not been reliable. Overall, I would say that unless you had symptoms and were tested in a hospital perhaps by a physician, then you're probably very close to accurate, but we move very quickly on testing.
Yeah.
So we don't really know everyone who's had it in a solid manner, or if they were asymptomatic.
Yes.
So we don't know, for instance, if I was asymptomatic, then my child potentially could have had it and been
That's
asymptomatic, and therefore, even though I didn't have the symptoms, I need to be watching my child for what?
Absolutely. So during this lockdown and during this pandemic, the message that has been sent out is to stay away from the emergency rooms. Just go there unless and until you are very sick. But this MIS is really different, and it's really unique. So as a parent, if you notice that your child is sick, he's just not acting normal, you should seek medical help right away. This is something that as parents you don't want to wait. You want to get evaluated right away because outcome depends on prompt treatment. So anyone as parents, I think if you have fevers, if you have someone who's just not acting right, who's very lethargic, who's very listless, who has a rash, who's just achy. Some of these patients, they've described their symptoms as fire-like sensation in their veins. So they need to be seen right away.
And so how long does it take from the time, let's say, that the first symptom comes to, I guess what I'm trying to get to is how quickly does the disease move through the body?
Very quickly.
Like days?
Yeah. Oh yeah.
Okay.
It's within hours. You would see them getting sick in front of your eyes.
Wow.
So that's why they need to be seen promptly.
And we have a question here that says, if they've had it in the past, could they have it again?
Perhaps not. Yeah. Kawasaki disease. We usually see about 20,000 cases in the United States every year, and we know that once they have KD or Kawasaki disease, they don't have it again. Very, very rare for them to have it again. So I know there are a lot of families out there. I have children in my practice who've had Kawasaki's disease, and parents are worried that they may be susceptible to something like this. But I want them to be reassured that they will be fine.
So have they developed the antibodies then for Kawasaki's disease, do you think?
No. The Kawasaki, you don't develop antibodies because it's an immune-mediated response.
Ah, gotcha.
So it's not infection-related. So they don't have.
So this is it MIS?
MIS, or pediatric multi-system inflammatory disorder, or multi-system inflammatory syndrome.
Is similar to Kawasaki in how it becomes, how it exists.
That's right.
You have to have that virus first,
That's
symptomatic or not symptomatic.
That's right.
So you don't know.
Yes. And most of the children we know, they have not had any symptoms. These are perfectly healthy children. And like I said in the beginning, it's affecting a little older age group, and it's also disproportionately affecting minorities more so than Caucasian children. About half of the children are African Americans and Hispanics. We've had. I read yesterday that there have been some children in Miami area, some in Orlando as well. Fortunately, we haven't had anyone in Volusia County that I'm aware of, but no.
And have you, in your practices in Palm Coast and Ormond and Port Orange, have we had children with COVID-19?
No, we have not.
That's great.
Luckily, we have not. I myself have probably ordered tests on about maybe a dozen children, and all of them they've come back negative.
That's outstanding. That's really good. And so also, the big thing we have to remember, I got gas this morning, and I thought, am I going to wipe my hands down? We have to decide if we're going to stick with all of these precautions. We're social distance, but we really should continue, because as long as that virus is out there,
Yes.
we can get all these other things attached to it.
Yes, I think it's very important that we maintain we just common sense measures, try to physically distance as much as possible, avoid high risk areas, grocery stores, etc. And what is interesting is the risk of infection is related to the time you spent in a high risk environment.
Right.
And so, you may be in a low risk environment, but if you spend a lot of time, you're still as susceptible to spending a smaller amount of time in a high risk environment.
Right.
So,
yeah, it's ironic, because what we did was we said, oh my gosh, stay away from elderly people or seniors.
Yes.
The reality is, we really are all in that group.
Yes.
It's just that they were very susceptible, and now we're finding out that children have a susceptibility, though not as high, it doesn't appear.
Yes. So the of all the individuals who get the COVID-19 infection in children, fortunately they've been spared. The numbers are close to 1 to 2% of all the positive cases are represented by children, which is reassuring. So I don't want the viewers to feel like it's something that's very common or that's very threatening. Fortunately, the children are faring well, and I think we should still need to be cautious, but look out for anything that's just not making sense.
That's not right.
That's not.
And you brought up a great point. As we say here, we're scrubbed and ready. We are taking every precaution possible at our emergency rooms to make sure that adults and children who would have COVID-19 symptoms or respiratory symptoms that could move in that direction, that we're keeping them isolated away from our team members and our other patients. And then likewise, we're making sure that we have kind of like groups with each other to make sure everyone's safe. Because the emergency room, it's ironic, when COVID-19 came out, we said don't go to the emergency room, because we were worried that if people came to the emergency room, we would get more people sick and healthcare workers sick, and we would be in a terrible position. Now we're saying, and I think that was the right thing to do, and now we're saying, don't wait. If you have an issue, especially with this, it's fast-moving thing. And I mean, I've seen a couple stories in the national news about mortality, and it's very sad, very sad.
Very sad for those children and for those families.
There's a question up here. Kawasaki disease is an inflammatory disease. Any advice from the doctor? Reaction listed as a vaccine adverse reaction.
I am not aware of KD or Kawasaki disease being associated with vaccinations. As you know, it's been around for several decades. We still don't have a very good understanding as to what causes Kawasaki's disease, but we have a very good idea of how to diagnose, how to treat, and how to prevent long-term complications. But I'm not aware of any association with vaccinations.
And then there's another good question up here. And again, we are with Dr. Salman Ahmed, who is an infectious disease doctor as well as a pediatrician for Halifax Health. And we're answering questions about the latest COVID-19 issue that we've seen, which is an overreaction or a reaction from your immune system.
That's right.
That happens after someone has COVID-19. There's a question here. So then what is the treatment if they have it? So we see the symptoms, which are rash, fever, inflammation, lymph nodes.
Yes, they can have swollen lymph nodes as well. Absolutely.
So
they can have involvement of the lungs, the kidneys. They can go into an organ failure. So these children are being treated with immunoglobulins, immunoglobulin infusion, which is similar to how we treat Kawasaki disease. But from the case reports that I have read, the doctors have also used prednisone or steroid infusions in these children to help suppress the inflammation. We don't usually use prednisone in children with KD. We use high-dose aspirin. So again, this is like an evolving situation. Over the next several weeks, we may have a better idea, better grasp as to what treatment works and what should be the way
Standard
to
of
address
care.
what would become the standard of care for these
That
children.
makes sense. Another question says, my daughter has IgA deficiency. Does this put her at an increased risk?
It depends.
What is IgA
So
deficiency?
IgA deficiency is the most common form of immune deficiency. About 1 in 200 or 1 in 300 children have IgA deficiency. These children are at increased risk for ear infections and enteric infections like vomiting, diarrhea, gastroenteritis. It really depends. I have not read anything. In general, we always assume that if someone is immunocompromised, they are always at high risk. But I think it would be incorrect to assume that IgA deficiency would make them susceptible to COVID-19 or in a way, this complication of COVID-19.
Well, that's good news.
Yeah.
That's good news. We really have to almost kind of, if we see symptoms, first of all, go to the emergency room.
Yes.
Secondly, kind of retrace your contacts.
Yeah.
And see if your child was exposed to someone with known COVID-19.
Yeah. I think parents have to remember that they are their children's best advocate. They know them better than anyone else, and if they do something that's not right, you have to be pursuant, and you have to make sure that they get seen.
That's crucial. And along those lines, Dr. Ahmed is part of our Children's Medical Center, and we have offices in Port Orange, Ormond Beach, and Palm Coast. And so if anybody needs a pediatrician, we're happy to help in any way, and we can be found on the website easily. And while we're on that, so we are out of school, which is interesting. It changes the dynamics. Has that slowed the practice down at all, or what have you had to do differently with your practice?
It has. So I normally was working 4.5 days a week. My schedule was cut down to 3 days a week. Our volume went down by 40-50%, but it's picking up again. And then I think it's time that we will reopen our offices to back to their full operation. And the whole idea was that we need to flatten the curve. Sooner or later, this virus is going to be around. We all will get exposed to it, and thankfully, the mortality is not as high that was initially assumed. So,
now, have you been doing telehealth, or can you really do that?
We are doing. Like on a typical day, if I'm seeing 25 children a day, 4 or 5 of them would be telehealth.
Gotcha.
So for medication rechecks and so forth, something very simple. But we do screen our children very well. We make sure that they have not been exposed, where they don't bring the infection into our office.
That's great. What else are you seeing that we need to kind of alert parents to, and what do we need to be thinking about? I assume our emergency rooms have been slower, I think, for 2 reasons. 1, people aren't out there as much, unfortunately, injuring themselves. But 2, people are worried about it. And you brought up the point that we screen everybody and take their temperatures and do all those things. But what else do parents, through this whole thing, whether it's mental or all these other things, what else do parents need to be thinking about to make sure their children are really, really in the best health possible?
Yes. So what we have seen is at this time of the year, we don't see much of respiratory infections like RSV or influenza, or so because of the lockdown, there has been a significant drop in these infections in children, and so especially right now, if you have an unexplained illness, it should be COVID-19 until we have ruled out something else. You brought up the mental health issue. I think it's important that children, they need to be kept in the loop. They need to be educated about what's out there. Just simple common sense measures like frequent hand washing and limiting their exposure to gradually, as the states are reopening, we may see a little resurgence, but hopefully, as they say, that hot weather and humidity is not very friendly to the virus. We are fortunate to be in a state which is not as which is more spread out, and
Yeah.
and so we do hope that the incidence would go down.
We are very fortunate where we live. There's no doubt about it. From a mental perspective and a physical perspective, the big thing I've noticed is kids and exercise.
Yes.
Can you kind of just talk about your thoughts on how important that really is? Because I
Yes.
see people
Yeah.
staying up late
Yeah.
and sleeping until noon, and it just drives me personally
so
crazy.
John has children, and I have kids who go to the same school, and they've been friends, and probably we can relate as to their schedule has been disrupted. They're going to bed late. They're getting up late in the mornings, but do activities such as riding bicycle or walking in the neighborhood where you're still not exposing yourself, and just we've all gotten creative in keeping them busy, but
That's the truth. That is the truth. What do you think about the beach for the kids?
I think beach is perfect.
I do too. I mean,
beach is perfect, and as long as you don't crowd in a gathering, you don't, you stay apart. So
okay, there's another question here. I worry there will be another rise very soon. My husband and I have kept our kids home while practicing social distancing, but do you think the second round will be just as bad? And I want to ask another question before that.
Yeah.
Do you think in general that the COVID-19 piece of it will come back in the fall or sooner?
I think that's what the experts are assuming, or they feel that is very likely to happen
For the fall.
for the fall, and hopefully we will have a better herd immunity by then. There are so many unknowns about this virus. We don't know how long the immunity lasts for. We don't know if the virus is going to mutate, and vaccine is another issue. Vaccines normally do take several years for development, but they have been fast-tracked, and we've had some positive news about vaccine development. So
Would you anticipate that when we go back to school, which I hope we did, I saw Amy Hall on here, I hope we go back to school, Dr. Ahmed and I both hope we go back to school, that there would be a vaccine for children by then, or is
Probably
that too
not.
soon?
No, it's too soon.
So then what would you envision our precautions if we are able to go back to school? Are we going to have our children in masks and things during flu season, do you think?
I think that remains to be seen. Hopefully we'll have a better idea as to what the numbers are, and I'm sure the epidemiologists will come up with their recommendations for schools where you could limit the hours, or you could or have maybe bigger classrooms, or maybe have the kids reduced, or give them an option of homeschooling versus on-site schooling.
Yeah, it's a big one to try to figure out.
I've been hearing from some parents where they feel like they may not put their kids back to school, but we just have to wait and see what happens.
Yeah. So in kind of wrapping up, and I want to thank you because this has been very informative, perhaps one of the most informative sessions we've done since the early on ones. And thank you for everyone who tuned in, because I think these are important things that the media doesn't always get out there because it's in depth, and they're kind of looking at it as in what do we quickly need to know. But I think the more education we have, what do they say, facts not fear. We have to stay with those facts. And if you have other questions, you can write in, and we'll absolutely ask Dr. Ahmed, and we'll answer them and get them back to you.
John, I wanted to bring something up. A lot of people assume that COVID-19 is the same as influenza in terms of mortality, in terms of how it's spread. That is not the case. That is not the case. And if we have some time, I'll explain to you why that is not the case. See, if someone has influenza, the statistics are you are likely to pass that on to 1.28 individuals. But if you have COVID-19, you pass that on to 2 to 3 individuals. Now, influenza, you get influenza within 3 to 4 days of being exposed to someone. With COVID-19, you can get COVID-19 as far out as 2 weeks after exposure. And COVID-19 is contagious for about 48 hours before you develop the symptoms. So that is why the attack rate is way more than, and it is one of the most contagious viruses known to mankind. I can't think of anything else.
Wow.
During my fellowship years, we used to say that chickenpox is the most contagious virus. Like if you have someone in a hospital with chickenpox, if they're using the same air ventilation system, another patient on a different floor can acquire chickenpox from them. But this is also airborne. This is also airborne, and that's why we have to be careful.
Yeah, and you know, there are all kinds of theories on where it came from. What are your theories?
I think it would be very, very hard to develop something like this.
Would it? Well, that's good to know.
It would be very hard. You know, these are very smart viruses. No matter how ingenious someone is, or it would be. I think it may have. Most likely, it's something that has evolved. You know, it has jumped from animals to humans. You know, similar to what we had with HIV, similar to what we had with SARS, MERS,
right,
that we had several years ago, that caused severe respiratory distress syndrome. So I think I am in the group that believes that it has evolved rather than it has been created.
This is a general question that just came in. They had someone who came back from the UK, and it said they are considered essential, but do they have to quarantine for 14 days? I don't know if that's your expertise, but what would you recommend?
You know, if they, of course, I'm assuming that, you know, they came by air, so
yeah,
so that puts them at risk. And again, what were they doing before they left the UK? You know, were they in a limited setting? Were they working at a public place? So there's a lot of ifs out there. But it's better to be safe and you know, isolate yourself for the sake of others.
So one thing that I gave some advice to a friend of mine the other day, he said, I've been looking at the testing, and there's a lot of different testing. There's a lot of what I would call non-scientific testing going on. Because if I test a group of elderly people in one nursing home, I might get a huge number. And if I go and test you, me, and some school children, I might get a totally different number. So I'm not as into the test. I'm really looking at hospitalizations and deaths.
Yeah.
Those are the things that I kind of look at. And I think we've had just around 30 hospitalizations at Halifax Health through this whole thing, which is very good.
Very minimum.
But I had a friend who said, I sat with a gentleman the other day and was looking over papers for real estate. He called me and said he tested positive for COVID-19. So my recommendation was that he just needed to kind of be cautious.
Yes.
I wouldn't say isolate, but, you know, practice social distancing. Maybe he should wear a mask, maybe not. What should he do? Because I don't know that going out and testing is the answer, because I'm not sure that.
Yeah, so I think the best recommendation would be that he should isolate. He should go in quarantine or limit his exposure to protect others. Within 14 days, he would know whether he's developing the infection or not. So that would be the recommendation. Now, as far as testing is concerned, there are so many different test options, and that's where everyone gets confused.
Right.
Now, the most reliable and the most confirmatory test is what we call PCR.
Right.
And PCR tests, you can have a turnaround within 24 hours, or you can take a few days to get the results back. Now, as far as the antibody tests are concerned, antibody tests do not become positive during your acute infection. They become positive after you've had infection. Right. So and some of these individuals and children, we know that they don't develop antibody after COVID-19. So again, that's not reliable. Now there is another test, which is a rapid antigen test, similar to what we do in our office, like a rapid strep test or rapid flu test. They're also not as reliable. But you know, if you have to put two and two together. If you have someone who has symptoms consistent with COVID-19 and you have a positive test, then you have to assume. You have to assume.
But we use here the PCR.
We use
and that's
PCR.
all we've used, because that's been what's been approved. But we also really have a policy procedure in place where we're testing people with symptoms.
Yes.
So you know, that is the most prudent approach, I guess.
Yeah. So and the reason why we are doing that is because of the limited test capability that we have, and we also know that. You know, I think last I looked at, Florida had about 40,000 cases of COVID-19. We probably have a lot more than 40,000. You know, if you factor in individuals who don't have any symptoms and the individuals who were not tested. I mean, if we do a widescreen test on everyone, if you do a screening test on everyone in the population, we will find out exactly how many were exposed and how many.
But that's the only way, is to test everybody.
That's the only way, but we are not there yet.
No. Now, one final thing, and I'll let you go. I ask almost everybody, gloves. Wearing gloves. I see so many people wearing gloves, and I just want to go up to them and tell them what.
So if you are wearing gloves, make sure you wear them properly. You know, if you are wearing gloves and you are handling everything from a shopping cart to your keychain to your door handle, and then you take the gloves off, you are still subjecting yourself to. So they should be worn properly. As soon as you are away from that environment, they need to be taken off and disposed of.
Very carefully.
Very, very carefully.
So it's very hard, and really you should sanitize your hands before you put them on.
Yes.
Wear them. Like you said, all you're doing is building up all this stuff all over them. And then when you take them off, there's a way to take them off from underneath and pull them off that way, and then sanitize your hands again.
Yeah.
Gloves are just a false sense of security.
John, I keep a bottle of alcohol sanitizer in my car, so whenever I leave the grocery stores, I clean my hands and wipe down the steering and so forth.
That's what we do.
I wanted to say one more thing, that I think we are really grateful and appreciative of our healthcare workers, the frontline healthcare workers.
Absolutely.
They are putting their lives at risk, and also the essential workers. Like, you go to grocery stores, they have these, you know, young students who are working there. Some of them, I've known them over the years because they were my children, and we really appreciate. So anytime we are out there and you see them, make sure please you do thank them for what they're doing.
Yeah, because they're walking into the unknown every day.
Mm-hmm. Absolutely.
And thankfully, they didn't just say, "I'm not going to do it." One more question, and then we'll wrap things up. It says, my daughters both attend daycare with only 10 kids. Is it safe to send them back to daycare?
Yes, so I visited a daycare recently, and I learned that they are doing a phenomenal screening process.
Good.
They don't let the parents come in. They pick them up at the front door. They do their temperature checks, and anytime they have something, they send them home, or they ask for a clearance. So I don't know for sure how effective that is, but that perhaps is the best way to
So really, if you're going to send your children to daycare, you need to see what precautions they take.
Yes, yeah.
And make sure they're doing hand, temperature, and wiping things down.
Yes.
And that's about as good as you can get.
Limited setting. I think we don't want to send a message of being afraid of this thing. I mean, sooner or later we have to cope with it, and we just have to gradually get used to this lifestyle.
Yeah. Well, we certainly appreciate your time. You got so many thank yous. And we certainly appreciate all of you joining us. And I think we will take you up on that offer to talk even more in depth, because I think that, the national media has done a good job of storytelling and things, getting into the science of it's very interesting.
And what we are seeing in our community would be more relevant to our viewers.
Yeah, absolutely. So thank you very much.
Thank you, John, for having me come over. Thank you, everyone, and we love you all. Thank you.